Welcome, everyone. Thank you for spending part of your day with me. My talk is entitled Twice Exceptional 2E, Neurodivergent, Highly Sensitive, and Medically Complex. A lot of terms, and we will go through all of it, and I'll give you some real world examples that hopefully you can kind of take with you today. I'm Dr. Jeannie Lopez. I'm a clinical psychologist and neuropsychologist working at Summit Center, primarily with children and adolescents and sometimes adults doing assessment, neuropsychological assessment and consultation. I also do health consultations at Summit Center, and I'm also a functional diagnostic nutrition practitioner. What that means is I'm basically a type of functional medicine health consultant. So first I'll start with kind of how I got here, because this is a really complicated task, complicated issue. And I got here because of my own personal and family journey. So I kind of know a lot of these issues well, and these are the types of clients that I work with at Summit Center, and I'm very passionate about this community. So I kind of wanted to share some of the things I've learned and just educate those in our community a little bit more about ways to think about their life and how to navigate their journey. So our outline for today, I'll define what is 2E for those of you that may not be familiar with the term. What is neurodivergence? What does it mean to be highly sensitive? How does medical complexity intertwine with 2E, neurodivergence, and sensitivities? And then how do we think about a case or cases and people's experiences using these concepts and this kind of framework? So let's start with what is 2E. I think the easiest way to kind of picture this is looking at a bell curve. And at one end of the bell curve, you've got, most of us, we think about certain abilities in like the 25th to 75th percentiles kind of range of average. People who are gifted are in the 98th percentile and above. So that's one end of the bell curve. And then people who have other struggles are kind of 25th percentile and below. But with twice exceptional, we argue that some of these individuals who have average abilities in one area and highly or profoundly gifted abilities in another area, we call them 2E as well. So the term twice exceptional or 2E refers to intellectually gifted children who have one or more learning challenges, such as dyslexia, which is problems with reading and phonological processing, dysgraphia, trouble with fine motor skills or getting their thoughts on paper, trouble with writing, ADHD, those with attention and executive functioning difficulties, or an autism spectrum disorder. Twice exceptional children think and process information differently. Like many other gifted children, 2E kids may be more emotional and intellectually sensitive than children of average intelligence. We kind of like to say their life experience is qualitatively different in many ways. They are processing things at sometimes a much deeper level than their peers. At the same time, due to uneven development, we call this asynchronous development, their learning challenges, twice exceptional children struggle with what other kids do easily. So you may say to yourself, my kid can memorize be in a play, memorize all these lines, but they can't write a story or they can't write any of their ideas on paper. And because of their unique abilities and characteristics, 2E students need a special combination of educational programs, sometimes counseling support, and sometimes just structuring their life differently. They thrive in different types of environments. And some of these traits are that I'll mention too. There's some other ones like being strong-willed or perfectionistic. We see this in the gifted community a lot. Some of these children experience existential depression, which is kind of, they experience that at a younger age. And sometimes that could be really shocking to families. So they explore kind of big world questions. And you're just like, why is this 4 or 5-year-old wondering about, how the universe works and the meaning of life and things like that? That does happen in this population more. And I'll give you some more examples from my practice. So for example, a young woman who was a gifted athlete at 12, yet in the classroom, she had, very slow processing speed when writing, had dyslexia and dysgraphia, but had this incredible athletic talent. Another example is a 16-year-old that I worked with who wanted to leave school. He was never assessed. he was found to have dyslexia. He got accommodations, and now he's thriving as a computer science major and really trying to reach his full potential. Another example, recent example, is a young woman who was a senior in high school, again, never identified as having problems, but she was working overtime. She was spending double the amount of time on her homework. She just wasn't doing well on tests, and it was clear she was really bright, and nobody picked on the fact that she had dyslexia and some auditory and visual processing difficulties because her verbal abilities were so strong. And she kind of compensated and looked good, so people in this didn't think she had a problem. Another example is a young girl who was in middle school, who was a talented artist and writer, and she had significant auditory and visual processing issues and some language difficulties that really made some of her social interactions difficult. Yet, if you asked her to write her feelings or write a story, it was extremely detailed and nuanced. So this just gives you kind of an idea of the types of individuals that we see. So the next topic is, what is neurodivergence? Well, it's kind of been floating around our vernacular for the last number of years. It was actually, the term was coined by Judy Singer, who was an Australian sociologist. And it's a non-medical term that describes people whose brains develop or work differently for some reason. So, for example, these individuals may have extraordinary artistic, math abilities, three-dimensional abilities, but they also have other areas in which they struggle. So this means the person has different strengths and struggles, and they're different from people whose brains work more typically. And what's tricky is this is really kind of coming from a sociological perspective, not from a medical or psychological perspective. We don't have this term in the DSM, which is our Diagnostic and Statistical Manual. It's also not a medical term, but it's kind of a term that we throw around all the time in society at this time. And it really doesn't distinguish between a difference and a disability. So it's just basically making an observation that these individuals have their brains are processing information differently. Some people who are neurodivergent have medical conditions as well. And sometimes they have medical conditions that have not been diagnosed or identified. Another way to look at this is that maybe their nervous system functions differently, as well as their emotions and things like that. So the problem is, I guess, when we take a step back, is do we really have a definition of what is a normal brain? I don't think we really know. I think that's a question that we'll be contemplating for eternity. But this is a term that people are using. And a way that Dr. Singer exemplifies this is one example she gave was a neurodiverse individual could be somebody who has autism, let's say a young child who has extraordinary abilities for drawing and art, yet maybe can't get through a day without help and assistance, versus a neurotypical individual who maybe learned those art skills, practiced those art skills for many years, and developed a talent. And that would be an example of the differences. So what are some examples of neurodivergence? Well, an autism spectrum disorder is one, ADHD is another, learning challenges that we talked about earlier, dyslexia, dysgraphia, dyscalculia, dyspraxia. Dyspraxia is difficulties with motor planning and kind of sequencing activities and sometimes getting started with activities. Sensory processing disorder, that can be trouble with, listening, vision, touch, movement, taste and smell, kind of your body position in space, your balance. Those are all parts of our sensory system. In my world, we focus a lot on figuring out if a client needs a referral for an auditory processing or a visual processing evaluation. And what auditory processing is when you assume that hearing is normal, but the brain mixes up speech and information coming in, sound, in different ways. And that's one area we look for. And you could say that it's a subset of a sensory processing disorder. Also visual processing. Visual processing, for a visual processing problem, you assume that the person's vision is normal or mostly normal, and then you go to what's called a developmental optometrist that looks at how the eyes work together. Can the person adjust to looking at the board in the classroom and looking at their paper without their eyes getting blurry? Do they have double vision? When they're reading, do their eyes track from left to right properly, or do they go all over the page? And there's many other problems that can happen. It's actually a whole nother discipline. Some other examples of neurodivergence, mental health issues such as anxiety, depression. I touched upon existential depression, obsessive compulsive disorder, bipolar disorder, etc. And medical issues, autoimmunity, infections such as Lyme and mold, Lyme or pain, hypermobility, immunological problems and disorders, hormonal imbalances and disorders, mast cell activation syndrome, which has to do with allergic reactions, postural orthostatic tachycardia syndrome called POTS, which some people might be hearing more about. It's coming up more in my practice, and so is hypermobility. Some of the clients have learning issues as well as some of these issues. Genetic problems, epilepsy, Tourette syndrome, and many, many, many more, right? So one of the questions that comes up is, as I was kind of reading up on this topic, is the question of, is neurodiversity a disability? It's not a medical or emotional condition like we talked about. Really, what I think Dr. Singer's idea was that this was really a set of strengths and weaknesses, a skill set. And when we're thinking about strengths and weaknesses, obviously we want to get a person into a place where they're using their strengths to the best of their abilities. And then if they have weaknesses, we want them to get some sort of accommodations or scaffolding or whatever help they need to support those areas so that they can be successful in life. So for example, you think about somebody who may be on the autistic spectrum wanting to work in the workplace, yet they have hypersensitivity to sound. Well, they're going to do well when they have headphones, and perhaps maybe if social skills are difficult for them, they will want to have a quiet work environment where they don't have to interact with people all day long. And some people on the spectrum have extremely good focus in areas of interest and attention to detail, so they will thrive if they're allowed to work in a setting that is consistent with their strengths. And some examples are of some people who are neurodivergent and have been very successful, or Temple Grandin, who has autism. Many of you probably heard of her. Simone Biles, who has openly talked about her struggles with ADHD. Van Gogh. There doesn't seem to be a clear consensus on what exactly he had. I was reading up and they said, oh, perhaps epilepsy, mood disorder, personality disorder, but some form of neurodivergence. So just being neurodivergent doesn't mean you can't be successful in many different ways. The next issue I'd like to address is the idea of misdiagnosis. So many times when we're dealing with all these complex issues like educational problems, occupational problems, emotional problems, and medical issues, it depends where you go for help. So if you're going to certain providers, you may end up with that type of diagnosis. If you go to surgeon, you might get surgery, right? You're more likely to get surgery perhaps. Or if you go to a medical place, you might get a medical diagnosis, and maybe it really is a more mental health diagnosis that's appropriate. So again, many times mental health diagnoses are given to those with medical issues. Sometimes clients are told it's stress. Well, it's extremely stressful to have a medical problem and an emotional problem. So stress is sort of part of the package of dealing with all this complexity. But I feel like it's very dismissive of providers when they say it's just stress and they don't offer solutions. And you will hear that many people have had this experience, and it leads into my next idea of medical trauma. I have heard this from many, sadly, young women and young people that have tried to get help for themselves in the medical community, and they are just dismissed, traumatized, not treated well, not talked to, not listened to. And sometimes this happens to the whole family in their journey. So sometimes, their symptoms they're minimized and ignored by providers that they go to. And some examples of the type of client that this may happen to is there's a condition called PANS and PANDAS, pediatric autoimmune neuropsychiatric syndrome and pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. Very, very long name for a condition that causes brain inflammation and lots of different problems with mood and neuropsychological functioning and everyday functioning. And many of the people who have PANS or PANDAS have obsessive compulsive traits and characteristics. And if you send them to a mental health setting could be helpful to assist, but if you miss the fact that there's a underlying medical problem and you don't address it, these children are not going to heal and they're not going to get better. And I have actually had some of these kids in my practice, and after taking a very detailed history and making a timeline is key, because usually there's some kind of illness or precipitating illness where things go wrong after that. The family usually says, oh, they got a cold or they got sick with a sore throat, and then boom, they weren't the same after. And then when they run it down, they would see symptoms flare. So for example, I worked with actually a very young child. He was only 6, and he had PANS and PANDAS. He also had mold there was mold toxicity in the home. And he was highly gifted. I mean, this verbally highly, highly gifted, but he could not write. His writing would change the size depending on if he was in a flare-up or not. When I worked with him, he came out of the bathroom with soap on his hands. He didn't even remember to wash the soap off. He was extremely perfectionistic, like very rigid, and kind of a little bit of the OCD flavor in the meetings. And the sad other part was that he had so many steroids that his adrenal function had been affected. So his whole stress response was very, very acute. So any little thing, and he would start crying, melt down. And then the next minute, if I could just be calm and redirect him, he'd be laughing hysterically. So his mood lability was crazy. It was up and down. So some of these cases are very complex. And in the end, it turned out he also had dyslexia. So there were just all these different ways that we had to kind of think about how to support him in his life, and also think about where we were going to get help for him. Another example is right now what's happening is a lot of people with long COVID, there are some doctors that actually feel that some cases of long COVID are a reactivation of certain viruses like Epstein-Barr or Lyme and co-infections. So if that can be teased apart, maybe other treatments can help these people who might not get help in other realms. Some people are sensitive. This community in general, the 2E community, is very sensitive. They have a lot of food allergies. They're sensitive to medications. They're sensitive to their environment. And sometimes you have to kind of dig and realize, oh, maybe the person's problems are from the side effects of a drug that they were given by somebody. Sometimes they don't. I've had some clients really not react well to antidepressants and just not be able to use those methods, those drugs, as a way to help themselves. Another thing that's not talked about much, and that we see a lot of, actually I see a lot of this in the autism community and in some kids with chronic illness, is constipation. If you're stopped up, you feel more sluggish and get fatigued. It sometimes leads to dysregulated eating. So these individuals' blood sugar levels are not stable over time, and that can cause mood issues. So again, these are really complex issues. And just one other area that I would like to address about the medical trauma is, this has happened, I've had several stories about this over the last number of years, about individuals who seem to have an eating disorder and they're put in an eating disorder clinic when really they have a medical problem. And in these cases, the whole entire family has been traumatized by the experience, because they're all forced to focus on food so much. And when the individual, in this case, it was a few young women, they knew in their hearts that they didn't have an eating disorder. They just didn't know what was wrong with them. And they really struggled. They're trying to listen to what the doctors are telling them and believe it, but in their hearts, they don't believe it. And it turns out that if they seek other types of medical help, which some of them did, they found out that they had, different issues, like, for example, celiac disease or a problem with the gallbladder that would cause digestive issues and make it so that you felt uncomfortable eating and didn't want to eat. So they were not trying actively to lose weight. Those are a few examples. So what does it mean to be highly sensitive? This term, highly sensitive or highly sensitive person, who was coined by Elaine Aron. She's got a whole website. She's written books. I love her whole perspective. If you're interested, check out the website. And here's a little bit more in depth. Individuals with high levels of sensory processing sensitivity, including traits such as increased emotional sensitivity. They have stronger reactions to both external and internal stimuli, such as pain, hunger, light, and noise. And they have a complex inner life. And some of these individuals may have a diagnosis, could meet criteria for sensory processing disorder, and some of them are just super sensitive individuals. Sometimes they may be more introverted. The way we kind of see some of these increased emotional reactions in everyday life, you could say that, like, if you're in a classroom and there's something happens, one student may just brush it off, the other one may have a whole meltdown and cry, become anxious. Sometimes these individuals just react more strongly to things. They may get frustrated more easily. Some young children may have more temper tantrums or meltdowns. And so by most of the rest of the world, they're kind of seen as sometimes out of proportion to what how most of the world would react. But for these kids, this is just how they're wired. And just one other term I'd like to kind of throw in here that kind of relates is kids and individuals who react strongly to things sometimes get in, they call it this amygdala hijack. So the amygdala is the part of your brain responsible for fear and aggression and your fight or flight response. So when you're faced with a stressor, how do you handle it? Can you rationally think through it? Or do you fight, flee, or freeze? And so this amygdala hijack idea is that you automatically fight, flight, or freeze rather than being able to calm down and rationally work through whatever the stressor is. So what that does is it causes a huge amount of stress on the body. So, you think about your stress response to something that's very scary, like if you're face to face with a lion in a cage or something like that, you're going to be sweating. Your heart's going to race. Your palms are going to be sweaty. You're going to be just really, really stressed. And these types of reactions sometimes happen to kids and people when they have sensory overload. So let's say you're an individual, you're an introverted, highly sensitive person, and you are forced to give a talk in front of a large audience, or you're forced to be in a very crowded place that you don't want to be and you don't feel comfortable. These patterns can kind of get repeated quickly so that your whole body is reacting very quickly to stress and you don't have a way to kind of calm down. And so that's why it's so important for people who are highly sensitive to develop whatever coping strategies they have that will work for them. Whatever it is that they can do to relax their body when they're faced with these stressors. All right. So how does medical complexity relate to these other concepts? So many individuals who are neurodivergent and highly sensitive have co-occurring medical issues and challenges, like we said. Some other examples are those with, let's say, Lyme or other infections. Sometimes they have brain inflammation, which causes them to have hormonal imbalances, mood issues, sometimes rage reactions, light sensitivity. Having a chronic illness leads to, many times people with chronic illness have fatigue, chronic pain, inflammation in the body and brain, and that can be due to many different things. I mean, for example, mold toxicity is another good example. People, their whole system can just go haywire for some reason. Certain individuals don't detox from mold. You could be living in a moldy home. One person can be fine and one person can be extremely sick. And these people are struggling every day with the results of, brain and body inflammation, fatigue and brain fog and other pain, all kinds of other issues. So there's always a lot of issues to explore and problem solve. Again, I go back to my kind of trick is making a timeline of symptoms and a timeline of life events that really helps sort out a case. So if you are struggling or your child's struggling, look at a timeline of things. And sometimes after thinking it through, talking to multiple family members about what happened and putting the pieces together, you'll discover like, oh, this started here. And oh, we also changed houses, or we did this, or you'll figure out what major stressors kind of precipitated some changes in behavior or functioning of your loved one. Another fascinating thing, I just want to drop this in here, there's this RCCX theory of giftedness, anxiety, and hypermobility. So this Dr. Meglathery is a psychiatrist and author, and I put the website in there if you want to explore it, but she's got an idea that there are a group of genes, a cluster of genes that leads to the development of certain autoimmune conditions, psychiatric problems, and it's also associated with hypermobility. So it's kind of a fascinating idea, and she has a whole web page where she describes studies. She talks about different genetic mutations related to detox and all these different things. But I must say that in my work at Summit Center, I work part-time, and I have seen so many cases of this triad, giftedness, anxiety, and hypermobility. And I don't know why. It's just fascinating to me too. So when I came across this, I was like, oh, this is, and some other examples of that these people struggle with the multiple chemical sensitivity, fibromyalgia, autistic spectrum, hypermobility or full-blown Ehlers-Danlos syndrome, which is a connective tissue disorder, rheumatoid arthritis or lupus, and then a lot of anxiety and sometimes depression as well. So another issue that's really important to think about when you're talking about medically complex cases is thinking about the need for flexibility in everyday life, and including if you're thinking about a child and their education. Some of these kids have flare-ups, or they have periods where they're not able to function as well, and they need the flexibility to stay home from school one day and just sleep, or maybe they just are overloaded and need a day off, or whatever it is. And it's really hard in our society because everything is so regimented and kind of, this is the way we do things, these are the rules. And this population needs a lot of flexibility in their life to be successful. And it also takes a lot of creativity for parents who are structuring the lives for their children and themselves to be successful and to have these children thrive. Another important concept is just the sensitivity of the nervous system, and we kind of talked a little bit about the fight or flight response with the amygdala hijack. Another thing sometimes that happens is there's autonomic nervous system dysfunction, so some of these people are just in fight or flight all the time. And so in that case, they need therapies that are going to work with the mind and the body. There's got to be a way to quiet the system from being so reactive to have success. Let's see. And we are seeing a lot of autonomic nervous system dysfunction post-COVID as well. So that's another reason I brought up that. Okay, so how do we understand the whole person? So as a neuropsychologist, I do assessments, and I'm just going to present neuropsychological assessment as one tool that can be used to understand these complex cases. For those of you that are not familiar with a neuropsychological assessment, it's done face-to-face most of the time, although during COVID, some people did it online in a room. There's paper pencil tasks, asking questions, sometimes there's computer tasks. And what we're looking at is we're looking at a range of cognitive and academic skills, and also emotional. We have questionnaires to address emotional issues, and we also have an interview of the client as well. So cognitive issues, we look at things like verbal comprehension, visual spatial skills, working memory ability. Working memory is the ability to take information in your head and manipulate it and then blurt out an answer. Processing speed is usually visual motor processing speed. We look at attention and executive functioning, memory and learning, visual spatial skills, visual perceptual skills, visual motor integration skills. So, writing, viewing things, drawing things. And then we sometimes screen for auditory processing problems and refer out to someone to do a more thorough evaluation. And then we look at academic areas such as reading, writing, math, and spelling. And that's kind of like the main areas. And each assessment is individualized for the client, and whatever we decide on in a consultation session are the areas of interest is what we kind of base our evaluation on. So for example, sometimes we might have a young person who's having a lot of trouble with attention and executive functioning and having a lot of emotional dysregulation. So we're going to focus on those areas. Sometimes we need a whole in-depth evaluation for multiple things, like, is this client on the spectrum with autism? Do they have a learning challenge such as dyslexia? And they might also be extremely anxious and have sensory issues. So those are some other examples. And we always start with a really detailed history, make a timeline. We think about, okay, what are the chief complaints that the parents or the individual are coming in with? And then we decide on the scope of the evaluation. And the goal is not just to find out what the child struggles with, but what are the child's strengths? Because those strengths can be used later when we're trying to plan interventions. So, some of these kids have amazing talents and gifts, and we can use those to our advantage when we're trying to implement other accommodations and strategies to help them. Okay, so after we finish the evaluation, what do we do? So usually I have a post, the parents read the report. I talk to them about what their feelings about the report are, what do they think? What do they think about the suggested next steps? And we kind of triage things. So in the case of these really complex individuals, we talk a lot about what other assessments are necessary. What other practitioners do we need to get involved? So I may identify a couple things, and there may be some outstanding issues about processing, like visual and auditory processing that I talked about earlier. And we need outside help and another evaluation to look at that. So who are we going to go to for help? Sometimes we need an OT, an occupational therapist, for help with writing, or we need a physical therapist, or we need a doctor to say, hey, does this kid have hypermobility or EDS, which is a connective tissue disorder? We need somebody to sort that out, or whatever the issue is. So who do we need? Who's on our team? How are we going to time these interventions and assessments? What's best for the family? I mean, we think about how much does it cost? How much time does the child, how much energy does the family and the child have to devote to these things? Sometimes it's very difficult if a child needs 3-4 different interventions. It's just not possible to do them all at once. So we kind of triage things and say, okay, we're going to do this for a few months, reevaluate, go on to the next thing. And again, many times I'm consulting with other practitioners, such as, is there a therapist on board? Is there sometimes I talk to occupational therapists, other medical doctors. It really just depends. A psychiatrist, it depends on the situation. And then depending on what the situation is, we have follow-up meetings to discuss findings from a post-evaluation assessment or other things, or just to kind of talk through where things are at after like 2 or 3 months. They've been trying things. Let's see what's gotten better, what hasn't, and kind of it's a place for parents or the individual to reflect on the progress that they've made or that they haven't made. And sometimes you have to kind of go back to the drawing board and think about, okay, we did this didn't work. What do we need to do next? And you have to be flexible because new information will be coming and going at various times. So other individuals we interact with are the schools. So there'll be sometimes IEP or 504 plan meetings. A 504 plan is kind of a list of accommodations, and an IEP is a more formalized individual education plan. So sometimes the parents can navigate those meetings by themselves, and sometimes I can help, or sometimes even a lawyer needs to get on board. So how did individuals with these challenges heal? So I would argue, not argue, but I would suggest that we need a team approach looking at mind, body, spirit, like the whole situation. How, if we're talking about a child, what is their family life like? What is their educational experience? How do they have time for fun? So how do we find a path where you, either the child or the family or the individual, feels in control of kind of where they're going. Because it can be extremely overwhelming to get a lot of information from multiple providers at once and to digest it all. I mean, when I talk to, sometimes I have these very long and detailed reports, and sometimes it takes a couple sessions for parents to kind of digest it. And sometimes you digest it in pieces, depending on what part of the problem you're dealing with your child. Again, the idea of triaging providers, treatments, medications, supplements. I've worked with families who are doing, let's say, work in their home for mold renovation, and they're trying to homeschool their child, and then they're trying to juggle auditory and visual processing evaluations with a whole functional medicine protocol to address the mold toxicity. That's a lot. And sometimes there are other, like occupational therapies along with, I had that one family dealing with all of those things. Education about each condition, I really feel like it's important for, especially parents, to understand what some of the diagnoses are, so educate themselves a little bit so that they can be good reporters to the professionals that they're working with. The more information that they can provide to someone like me or a medical professional, the better the treatment's going to be. The more details or detailed examples of struggles and or things that went well, the better we can be at our job. And people need a place to explore and discuss these treatment paths. So that's something that, you know, one member of the team can provide. The willingness to try new things and move on from things that are not working. Sometimes you have to make a decision. Okay, we've given this like 3-4 months. Like, are we going to, you know, ask the provider, are we getting enough out of this treatment? Do you think we should stop, go on? Why or why not? Sometimes there's times for that. And then sometimes you even need to circle back to previous therapies. So I'll give you an example of many times I have kids who've had occupational therapy when they're very young, and no one ever said, come back for a reassessment, you're fine. But then later on, things are kind of falling apart at the start of puberty and things aren't going well. And then we kind of need to revisit it again. So that's something to consider. I kind of say to families, never say never. Consider developmental issues and stages when making decisions about interventions. So, you know, what is okay for an elementary school child? What can we expect? You know, how do we explain this to them? How do we guide them through it versus a high school student or even a college student? So, you know, and then we kind of, again, when you're kind of I call it triaging things, when you're trying to prioritize where you're going with your roadmap, what, you know, I kind of sit with parents and go back to, okay, what is the primary thing that you think your child's struggling with or you're struggling with as parents? And then sometimes that kind of brings us back to what do we do next? Elements of daily life to consider. Home. Is there structure in the home? What does the home environment look like? What modifications to the home environment are necessary? For example, kids with ADHD or who are on the autism spectrum may need very specific reminders about daily life skills, like maybe a picture of brushing your teeth, just pictures of things. They may have different bins for different clothing items and know we go to bin 1, 2, 3, and that's how we put our outfit together. Things about homework, what does homework time look like, who helps with homework, and then in a work setting, think about the person's strengths and weaknesses, what kinds of accommodations do they need in the workplace, and the school environment. A lot of times we use the neuropsychological testing report to interact with the school and vouch for more accommodations and try to for the child. And then in that process, one of the other things that I like to think about is the idea of advocacy. Is over time, we hope that the child will learn more about their strengths and weaknesses profile and be able to ask for what they need in the classroom. But in the beginning, if you have an elementary school child, this will be really the parents doing that. And my goal is to help empower the parents to feel like they can advocate for their child, like they know how to talk about what the struggles are. They know how to go to the right school personnel to get what they need. And that can be a very tricky process in some settings. So there are some families that need to even hire an advocate to get a 504 plan because the child is so bright, they're accessing curriculum, the school says there's no problem. But if you look at the scores, there is a big problem. And that kid may be missing what's going on in the classroom, they're spending hours on homework. They're just working way harder than they need to. So social emotional issues. Think about what are the social needs of the child. Is this a very extroverted child, an introverted child? What hobbies and interests do they have? How do their struggles affect them emotionally? For some people, there's kind of a grieving process to what you've lost when you have a medical problem, like the life that you could have had. And thinking about that, how might a child go through something like that? Like, let's say they're in pain one day and they can't go play with their friends, or they're homesick and they miss out on a lot of fun activities at school. So just kind of putting that on your radar and having conversations about it, or checking in to see how the child's doing. Spiritual modalities. So for some individuals, this is super important. Meditation and prayer and a spiritual practice can help ground them in this crazy world. So exploring what types of things work for them. We already talked about developmental and lifespan issues, like what stage of life the person's in, and kind of what are their developmental tasks. So one example is 2E individuals are notoriously, there are many who don't have the strongest attention and executive functioning skills, I'll put it that way. And they kind of sometimes lag behind in the development of those skills. So they can do these complex tasks, they can do all this other stuff, they can talk to you and solve all these other problems and have all these great ideas. But when it comes through to executing some daily activities, they lag behind. So I think just being aware of asynchronous development is another, we talked about that in the beginning, and here it is again to consider. And then for medical issues, navigating the system. This is a big one. How do you navigate? How do you find the right doctors who will listen to you? How do you deal with, if you've had a medical traumatic event, how do you kind of overcome that or get help for that? How does that influence your desire and your motivation to go get help in the system? How do you do that? And for some families, this could be super complex when you're trying to navigate mainstream medicine and also do alternative therapies and try to find a happy medium in between. It can be very complicated. And I'm just gonna brush on the whole idea. I don't know how many of you are familiar with the idea of functional medicine. This slide is a great visual for kind of explaining some of the differences between traditional medicine and what functional medicine is doing at this time. So above the iceberg, at the top of the iceberg, what we see, we have labels for diseases such as cancer, arthritis, heart disease, autoimmune, diabetes. In mainstream medicine, we go to different doctors who have different specialties and get different drugs and therapies, and sometimes whatever interventions. Functional medicine community goes a little bit deeper and has different assessment tools, different types of tests, different types of interventions, and they look at the underlying causes of some of these things at the top. So, for example, when you have an environmental heavy metal toxins or heavy metal exposure, you're going to have problems with detoxification. You might have hormonal imbalances. Your mitochondria, which is the powerhouse of the cell that makes the energy for the cell, has dysfunction and doesn't work. So you don't have energy to get through the day. You look at immune system issues, digestion, what's your microbiome look like, inflammatory issues, structural issues, and then what other emotional components are there? Because it's really hard. You can argue that anybody who's dealing with a chronic illness is having some sort of emotional stress. I mean, it just comes with the territory. Sometimes people are worried about the test results that they're going to get. Everybody's scaring them. Is it the worst case scenario? They can't do their daily activities, so they're frustrated, fearful, they get angry, like I talked about earlier, kind of grieving, different aspects of grieving the life that they could have had. And so these are just this is kind of just a brief overview of kind of where functional medicine goes when they look at some of these issues. All right, now let's get a little more upbeat. Where do we go from here? We've got our assessment. How do we heal? How do we start a roadmap to success of trying to put everything back together? So I'm going to go over each of these in more detail, but this is just kind of the next outline of where we're going to go. So we're going to talk about diet. We're going to talk about rest and sleep, the idea of sleep hygiene and circadian rhythms, exercise, stress management, spirituality, supplementation, medical interventions, supports, educational and occupational support, family support and education. And now let's just go into each one in a little more detail. So for diet, again, this is not usually done in a neuropsychological assessment setting, but from my perspective, these are conversations that we need to be having. I need to be having with families to find out what is the landscape, especially when they're dealing with medical issues. So one of the most important things people can figure out is how what you eat affects how you feel and function. Does the fuel you're putting in your body give a good output or not? And if it doesn't, maybe you should take a step back and kind of look and review and say, hey, is this working? Is this diet working for me? And why or why not? So there's 3-day food diaries out there that you write down what you eat, and then in the next couple hours, there's a check off, and you can look at like different things, like when you eat chocolate, does your heart race? Do you get itchy? Do you have diarrhea after you eat? Or do you get very anxious after you eat a certain food? And over time, people can really make connections between how they feel, their mood, and how they feel physically, and their mood, and what they eat. Hydration is another issue. It's not just, it's both the quantity and the quality of the water you're drinking. So I don't know if any of you were hearing what happened with fluoride last week, but there's been like a 40-year battle to get fluoride out of the water, and they finally in the courts said that it was a problem, even though there's been a long history of fluoride leading to different problems in the body. So, good quality filtered water. You don't want microplastics in your water, and drinking enough water. I mean, it's amazing when you talk to people how just drinking more water can make a difference for them. Decrease genetically modified organisms, GMO foods, and decrease processed foods. One of the things they say is shop the perimeter of the store, where you're just getting more like fruits and vegetables and meat and fish and things like that, rather than getting things in a box. Buy organic or go to your local farmer's market. Eat the rainbow. That's a simple thing that could be good. Try to get your children to eat the rainbow. Try new things. Learn to read labels and to cook. I've been surprised in my private practice how many people don't know how to cook at all. You're starting from scratch. So, there's tons of videos out there. And if you do have food allergies and food sensitivities, you have to learn to read labels. And even then it gets very complicated because our labeling laws are not 100% the best. Sometimes there's hidden ingredients and it gets very complicated. But in general, I think we need to teach our whole society, children and adults, where their food comes from and how to cook, how to shop, and kind of make that important in life, not make it a second thought. And during COVID, it was really interesting to me when I worked with some clients that nobody was making them any food. They were kind of on their own, so they were skipping meals and just not getting enough nutrition. And then as far as food allergies, food sensitivity testing, there's a lot of different ways you can do it. You can go to a mainstream allergist. You can go to functional medicine doctors who have different tools. There's different ways to kind of find out about those things. So I'll just give you a recent example of a client that I had who is on the autism spectrum, a young person who's really wants to work on her diet, and she was not eating enough protein. And in just 3 weeks, she's like, Jeannie, I did it. I figured out that I need protein. But because of some of the sensory sensitivities that she had, she can't tolerate meat, the texture of meat. So she's moving to chicken, and she's just trying in her way to make baby steps. And she's also really constipated. So she feels sluggish, then she doesn't eat, then her mood drops and she gets tired, and it's this vicious cycle. So we're kind of working on how do you cook? How do you shop? What foods make you feel good? What foods make you feel bad? And another example are kids with who have tend to have low blood sugar. They need to eat more often, so they can't skip meals, or you'll have huge behavioral issues. So those are some examples of how diet's important. Rest. Here's another one that our society hasn't been doing the best with prioritizing. So here are some tips. Aim to have a consistent bedtime every day. Get early morning and late afternoon sun. Spend time outside. Get off screens, especially before bed. No caffeine before bedtime. Limit blue light exposure. Kind of think about having a consistent sleep-wake cycle. Exercise. Think about your favorite types of movement. What's comfortable for you. What level of exercise is appropriate? Some people can't do high impact exercise. They need more core strengthening. They may need physical therapy to make their gains. They need more guidance. Start slow to avoid injury. Think about aerobic activity, flexibility, strength training, what combination, what works for you. And sometimes, so for some of the kids that I see, they have really poor core strength. So going to physical therapy can be really helpful. Then they're better able to sit up at their desk and to write. Some with hypermobility need special forms of physical therapy. Things like yoga may not be the best for them because they tend to overstretch and stretch too far and get injured. So again, it's a similar concept to the idea in sensory processing that we need a sensory diet. We kind of need an exercise diet too. Like what's the right balance for each person? Stress management. Consider what the source of stress is. So sometimes there's emotional stressors, sometimes it's actually physical stressors, sometimes mechanical stressors. So I've seen some really fascinating cases of kids who've had, and young people who've had maybe like a head injury where their cervical vertebrae have been moved, and they have all these physical problems and mental problems like anxiety and depression because their neck is on straight. So sometimes that's a piece of the puzzle for some of these kids. Do they have infections? Do they have pain? There was a case I consulted on where this child had nobody was talking about it, but she had broken a vertebrae and she was having all these angry outbursts and everything. This child was in pain and nobody was addressing it. So we kind of figured that out. What strategies do you have in place to deal with stressors? Where do you get help? How do you structure your day? What are your go-to activities to relieve stress? And are these things working for you? And if not, where can you find more help? So for some kids, sometimes it's nice to integrate activities like yoga or Tai Chi or something relaxing that's like a group activity and not another therapy. For some of these kids go to so many therapies, they kind of get burnt out. So I always say, like, let's think about activities that are pleasurable to the child, but that can have another benefit for us, of decreasing stress. For supplementation and medical support, consider what type of medical and healing setting works best for you. Some people just want to go the mainstream. Some want to do both. Some say no to the mainstream. What are your values and ideas? Where do you want to go? If you're in a traditional medical setting, what types of interventions are you considering? What providers are going to offer them to you? If in a functional medicine setting, do you have a provider that can address your medical concerns and provide supplement herbs, maybe homeopathy to aid in healing? There's so many different modalities out there. And then how do you try to maintain an internal sense of control over the process and feel like you kind of have the pros and cons, we call that informed consent, regarding your decisions? Do you really understand what are the risks and possible risks and benefits of the treatments that you're choosing? I think that's really important because I can tell you for some medical settings, they push you and say, you have to do this right now. You don't have any time. But maybe that individual wants to wait and kind of digest things first and have a chance to just process what they were told before they choose a treatment, especially if that treatment could have significant side effects. So again, consider pros and cons of side effects. I mean, another interesting, just a little tidbit of what's out there in the functional medicine realm, there is a test that can look at how your liver metabolizes different drugs and can give, it kind of has a whole list of, not every drug, but certain ones like antidepressants and other things. And it can say, oh, given these genetic mutations that you have, X or Y drug may be better or worse for you, or you may have trouble metabolizing it, so that it might not be a good choice. So things like that exist out there. Educational and occupational support. Again, this is where we use the neuropsychological testing report in dealing with schools. What accommodations need to be made? Usually schools start with a student study team meeting, and that's the first step. If things aren't going well after that, they make a 504 plan or an IEP, what needs to happen. And I always counsel parents on like, who's going to provide those services, how often, who's going to be kind of accountable to tell you that those services occurred or give you feedback. How do you track the efficacy and the quality of these interventions? Sometimes parents choose not to go with the school and they want outside providers to do educational therapy with their child. And sometimes you need a lawyer or an advocate to help you navigate. And I've seen that several times. And this oftentimes happens for 2E individuals because, like I said before, because they're so bright, the schools don't always recognize their struggles. And sometimes we have to push more and advocate more for them. In a work setting, is there a need for a disability evaluation, for medical issues? What modifications need to be made in the workplace for success? Does this person need a flexible work schedule to accommodate for their issues? And so on. Family support and education. Individual therapy, family group therapies, all of these are out there. There's also somatic therapies that are kind of more mind-body therapies, and there are actually somatic therapists who specialize in those types of things, and they may incorporate meditation and yoga and other things into their work. Education. So for the family and the individual, what types of information do you need to make the right treatment decisions for your child or you and the family? And who can help with this? Sometimes, like I said before, reading books, there's a lot of information on the web, different organizations out there. There's an organization called Misunderstood that explains what different learning disabilities are and has lots of free information. The goal here is, what do we want? We want everybody to have a balanced life, right? We want well-being. We want to be happy. We want our children to be happy. And these are, again, kind of some of the areas that I touched. Some of them I didn't, some I did, that I touched upon throughout our talk today. But I think we just need to, be open-minded to different possibilities coming our way. And I'll just go over these because I think they're a little bit small on the screen. So emotional well-being, financial well-being, social well-being. We want a community of support. We want good relationships. Spiritual, whatever spirituality is to you or your family. We want purpose and meaning in life. Occupational, we want a job that we feel good about, that we feel like we're contributing to the world. Physical issues, diet, sleep, nutrition, all those things I touched upon earlier. Intellectual, we want to use our creative abilities, especially these 2E and really complex kids. They have extraordinary talents that need to be shared with the world. We need to recognize those and find a place for them to showcase them. And environmental, we want the right environment so that we can all thrive. All right, now some kind of wrapping up here. Case management is kind of, I think, key. This is a key idea that we need to realize that a simple neuropsych eval is not going to change everything. We're going to need a team of providers. We're going to need a plan. We need to look at treatment holistically. We have to assess. We have to pay a lot of attention to detail as we're assessing the situation. Some other things to realize is many of these treatments are based on the idea of neuroplasticity, that our brain can change and we can learn new things and rewire the brain. That's one of the foundations of auditory processing and listening therapies and so many other therapies. We need multisensory interventions. We want to get at things in different ways so that the child can thrive. Some children just are not auditory and visual learners. Some need to be moving while they learn. They sometimes need to be singing or doing other things while they're learning. Focus on the strengths. Again, like we talked about earlier, the goals are to increase confidence, advocacy skills, Consider having one professional in the role of a case manager who can kind of check in with everybody and kind of coordinate things and be kind of a checkpoint. That can be helpful. So I guess this is just to summarize. You want to address the complexity that are these humans. You want a multidisciplinary approach to assessment, treatment, and you want to consult and collaborate with other professionals. So thanks everybody for coming today. Take home good health equals a good life. Should all strive for that. And here are just a few references. There are many, many, many others. So thank you all for coming today. And I think Elizabeth will address some questions.
Yeah, we thank you so much. We have about a dozen questions, so we'll see what we can get to. And I know, okay, so someone's raised their hand. If you could just put your question into the Q&A or your comment, doesn't matter, but that's a great way to communicate. So I'm going to just start with the earliest question. A neuropsych evaluation can uncover things. For example, it uncovered auditory processing issues for us, amongst others. But what can actually be done for these and other sensory challenges when it's a teen and not a preschooler? Accommodations only go so far. What else can be done?
I would say you have to go outside to the to different realms for this. So you can get so far with OT, but there's another form of, some OTs are trained in what's called the Muscatova method of reflex integration. And what this is this assumes that there are 26, I think, primitive reflexes, and if they don't integrate over the child's development, they can lead to different problems. So that's one area to consider that could be helpful for a teen. And auditory processing, I mean, there's different listening therapies, and those can be done at all ages. I mean, there are adults doing listening therapy just to, like, for example, integrative listening systems is used for kind of to increase performance, job performance. For some people in different companies use it. So it's not just used for kids. Any follow-up questions to that, or? Okay.
I'm going to go to a later question, but this one had some upvotes and people can feel free to upvote. I have a 21-year-old with POTS, CAS, hypermobility or EDS, CCI, PTSD, and anxiety. Because of medical trauma, she is refusing all medical intervention. She is high-functioning autistic and has a PDA profile. We need neurodivergent focused therapists that understands chronic illness and trauma.
Yeah, this is a real tricky one. I'll just say up front, I'm not a PDA expert, so I would defer to some of my colleagues for help with the PDA. But yeah, this is a tricky issue because she's refusing any help. And I think what happens is their whole system gets so much into fight or flight, it's so hard to quiet it down. There's a wonderful, I don't know if you're familiar, but Neil Nathan is a doctor in Marin who has dealt with many, many Lyme and mold patients over the years, and he's written several books, and he has a new book out that kind of addresses has different suggestions for different types of therapies. I think whatever you can do to quiet the nervous system, that's going to be step one. Because if you don't do that, you just can't get very far. And I think the problem is sometimes in our field, we go to therapies, but we need more than that to quiet these individuals' nervous systems. Yeah, there's so much, I have so many more questions for this person about it, but that's just, that would be a good source for help, is to read over Neil Nathan's latest, there's one book called Toxic, which is about mold, but then the highly sensitive patient or something, I can't remember the exact title, but his latest book is really good and goes into detail about a lot of these issues. And he has different chapters written by different professionals. So there's like a whole MCAS chapter and things like that.
I would also say that go to summitcenter.us, our website, or email inquiry@summitcenter.us, and that will give you the forms to request an appointment. Because there might, maybe like a team approach from Summit Center. And some of the other questions people are saying, can I schedule? Yes, Dr. Lopez is available for consultation, and just email inquiry@summitcenter.us, and then you'll get the forms to request an appointment.
So just one more idea for this last person's question is homeopathy, because that's relatively easy. You're just taking, it's hard to know. I don't know if people are familiar with homeopathy, but those remedies are easy to use. The person just drinks distilled water with the remedy in it. And sometimes that can make a shift, but you need to work with someone who really knows autism. There's a woman called Anke Zimmerman, and I just took her autism and homeopathy class this last year, and she is super smart. She would be a good person to consult with. She's in Vancouver, but I think she's moving to Florida. Last name is Zimmerman.
That sounds great. Next question. I've got a 13-year-old who is on the spectrum who also has sensory processing disorder and has been struggling with anxiety. And now we are seeing a lot of struggles with what looks like IBS. How can we navigate this in a way that doesn't cause more issues for him?
So I would say, I'm not sure what you're doing. Like I mentioned earlier, this other type of occupational therapy can sometimes be really helpful for some kids on the spectrum. Well, for all kids actually, but sometimes there are kids on the spectrum who are not going to do mainstream OT, or they're defiant or whatever. And sometimes this Muscatova method it's just a little bit less in your face, and they can tolerate this better. So that is one idea for the sensory issues. And then for the bowel issues, again, you could go to mainstream medicine and ask for whatever they're going to give you, but you probably get more if you go to a functional medicine doctor and do a stool test and find out what's actually going on. There's a stool test there's many different types, but one is called the GI map by Diagnostic Solutions. It looks for bacteria, fungi, parasites, and yeast. These are very common in our autistic population. I think a good functional medicine evaluation would give you answers and not leave you kind of hanging with the IBS diagnosis.
Thank you. Next question. How common does ME/CFS coexist with neurodiversity and other issues that you have mentioned?
Yeah, I mean, I think the ME/CFS kind of, it kind of relates more to it's common with the Lyme community too. So yeah, definitely part of the puzzle. Definitely, yeah.
Following on, there is no cure for ME/CFS. So are there suggestions for how to help these children?
I think you need to rule out mold and Lyme and co-infections and other viral infections too, because they're commonly linked. And then look at heavy metal toxicity, kind of do the functional medicine approach. Another approach, again, homeopathy can be super helpful for really, really sensitive clients. So for example, I know a family who has a 17-year-old with pandas, and they are doing homeopathy. It's very slow, but it's working.
Great, thank you. Next one is, I have a 2E AUD,
Auditory processing?
Maybe that's it. 15-year-old with POTS, SIBO, Candida, extreme anxiety, hypermobility, and is in burnout. How do you find doctors that can evaluate a child with all of these issues? Do you take them to an internist? Most specialists are staying in their areas and not looking at the whole picture.
I totally agree with that statement. The mainstream, I'm trying to be open-minded here, but honestly, you have to go outside the mainstream. You can only get so far with the mainstream. And SIBO is, I forgot what came before SIBO. there was one other, Elizabeth, what was before SIBO?
Yes, POTS.
Oh, POTS, yeah.
Candida.
No, I thought, the Candida, yeah, the Candida. So Candida is a lot of times is linked to heavy metal toxicity or chronic mold exposures. So the only way you're really going to get help is through a functional medicine doc for these issues. And even within the functional medicine field, there's so much variation on what types of tests people are using, what types of interventions. I mean, it really is, I've been down this road with myself and my family for, I don't know, my whole life for myself and at least 20 years with my kids. And it's been a journey. I just keep learning. And honestly, functional medicine is changing so fast all the time. But I think you're going to get the most help from a functional medicine provider. The mainstream is just not looking at these things. There are some docs, there is a doctor at UCLA researching SIBO, but he's not a clinician. So you're just going to get much more nuanced help and characteristics of the problem from the functional medicine community. The question becomes, what do you do when you get all that information, you have all that information, how do you choose the right treatment path and how do you prioritize the treatments? Because that matters as well. And what can the child handle? Because some people are super, sometimes they want to use certain heavy duty binders for mold toxicity or heavy duty drugs for Candida, and the person can't tolerate it. So I've heard stories, and I know about experiences where, for Candida, you try the mainstream drugs, the person has a horrible reaction, gets worse, they can't handle the die-off. That was not done right. You have to start low and slow. There are homeopathic drainage protocols out there that get the lymph moving, the kidneys, the liver less kind of congested. Sometimes you can do a drainage protocol before you even start a treatment for highly sensitive people. And this is something that's being discussed more in the functional medicine community. It's not about getting rid of the viruses, getting rid of the mold quickly, shoving the body with all these binders and all these drugs. You gotta be slow, gotta go slow and slow. So those are the things I would suggest.
Mm-hmm. Thank you. Here's another parent. My child has EDHS, ASD, POTS-like symptoms, functional neurological disorder, and we've accumulated a decent team of specialists. But I'm wondering whether viral or mold exposure has been overlooked and what kind of practitioner should I seek out?
So there are functional medicine practitioners are, well, not all of them I can say, but a naturopath might be an example, or a functional medicine doctor. Sometimes there are clinics, it depends where you live. There are clinics in California. I just was made aware of some other clinics in Sacramento area that have a kind of a comprehensive team approach to things. So going to a clinic with multiple types of providers is probably another idea. You've already got one team, or just someone who specializes. If that's your question, someone who really knows that area. Usually you can find that out through, there are Facebook groups. A lot of people give information to each other on Facebook groups. There's an EDS Facebook group. There's all kinds of things out there. And maybe put a few questions out there to see, I don't know where you live, to see what providers are out there.
Thank you. Another question, what are resources for increasing communication in children who aren't fond of using words? As she struggles and I try to understand her perspective, her answers to questions are nonsensical words like doinky. I try to talk later, often offer describing words, but no luck. What else can I try?
So it sounds like maybe there's a speech or language problem going on, or communication problem. So maybe working with a speech language pathologist to kind of characterize what that is. Are we talking, basic functional communication is not there? Are we talking like lack of emotional communication? Like sometimes children don't have those feeling words, they can't express themselves. Sometimes, so I would say from what you described, maybe a speech language evaluation would be helpful, and that provider could guide you. Sometimes, play therapy, where the child can just sand tray therapy, play therapy could be helpful for the child to express themselves in a way, not using language. Yeah, I'm not sure what exactly the problem is. So that would be two ideas.
Thank you. Next question. Do you have a food diary that you recommend?
I do have one. It's just something that I learned in my FDN program. It's just, it's a sheet. Yeah, I don't have it. I mean, I could, if you give me your email or send your email to Elizabeth, I could send a copy to you. Mm-hmm.
Yeah, and that would be emailing update@summitcenter.us, where the emails about this webinar have come from. Okay, next question. We keep on adding more, so you might want to take a look at some point or decide when we want to wrap this up. Our son is a 13-year-old 2E learner. We've made great strides, but implementing many of your suggestions here, but I'd like to introduce more. But I sense he's burned out on feeling poked with us trying to figure him out. He's tired of feeling different or weird. Any suggestions?
Yeah, I mean, I think sometimes there's a time when kids need a break. And as hard as it is for us as parents and providers, because we want to do everything we can for our children, sometimes these kids just need a break from being therapized and going through all this. I've had this conversation so many times with parents. They just need a break. They need to just do something different for a little while. And maybe that's a discussion that you could have about, would that be an option? What does it look like? You can talk openly about, why you want to do more, and your child could talk about why they do not want to do more, and just come to some understanding, like, do we do this for a few months? We just take a break, and, are there some other activities that your child feels that they're missing out on that they want to do instead, or they just need a break? So that, especially with teens and young adults who've been doing this for a long time, that does come up.
That's great. Thank you. Next question. Where do we find auditory processing options for young adults? Little to nothing available locally. Where can we find online options?
I don't know about online options. We at Summit Center work with Dr. Deborah Swain at the Swain Center, who we refer to, and she does the full tomatis listening therapy. She's actually a speech language pathologist who also does auditory processing. Sometimes people go to audiologists, and there's a huge debate over what types of listening therapies to use. Every provider seems to have their favorite one. So you could call it's called, if you Google the swaincenter.com, I think it's called Language Learning and Beyond now, but it used to be called the Swain Center. You could perhaps see if there's anything on Dr. Swain's website. She's also very active in a lot of the speech language groups and very up to date on auditory processing. So perhaps her center, if you called there, you might get a referral. I actually was looking, I had a client from Pittsburgh, and I could not find, we couldn't find one, and the family was just considering coming out to California. But it really depends where you live. But that could be one place to call, at least, because I know Dr. Swain is quite connected in the field. If you're on the East Coast, Donna Geffner, Geffner, she's in New York. She's an audiologist who specializes in auditory processing. I think she's on Long Island. She could be another source of information if you're on that coast or out there somewhere.
A few more questions here. And if we don't get to your question, feel free to reach out online or schedule a consultation. Next one that had some upvotes. What do you see around 2E and gender dysphoria?
And I didn't get into that. Yes, honestly, at Summit Center, what we're seeing more gender dysphoria in the autistic community, like the kids with autism, and many of which are 2E. Yes, we are seeing more of that. Definitely in the last, 4 or 5 years, I would say. And we've been, yeah, we are seeing more of that. And most of the time, from my perspective as a neuropsychologist, it has not been the presenting issue. It's just most of the time in the assessments that I've done, it's been present for some, but they're already getting counseling, or some of them are just okay with whatever decision they've made. So yeah, but there are therapists out there who specialize more in this field than I do, that you could go to for help if that's the presenting issue.
Any resources Dr. Lopez could point us to for dysgraphia in high school? Most of what I come across is related to fine motor struggles and much less related to the struggle of putting thoughts on paper. My PG 2E child is struggling with this, plus perfectionism.
Yeah, so I think what's really important in dysgraphia is to kind of tease apart what are the kind of executive functioning pieces versus the fine motor, where is the child struggling, and then when looking at the developmental stage. So for a high school student, we would look for, it sounds like in this situation, you need more help with the executive functioning piece of writing, planning, organizing. So an educational therapist who specializes or who has knowledge of different ways to teach writing and approaches to writing. Some of these kids really benefit from a structured approach where they kind of learn a certain way to write a certain type of thing, and they kind of compartmentalize it, practice it over and over again, and that's kind of the way that they're gonna write successfully. So for example, some of these ed therapists have different techniques on teaching that, and so that may be a way. And then if the child also has trouble with the actual active writing, there are different assistive technologies, but it sounds like the main struggle for your child was the executive functioning piece. So I would say if there's some kind of ed therapist who specializes in writing, or even an occupational therapist, it just depends on their skill set. That's the thing these days. It's so hard to find people because we've all got our little cluster of skills and we're all trying to make a match between, what we do and what the client needs.
Yes. Okay. So this is going to be the final question for the official part. And this parent says, this seems like a full-time job. How can a family who is entirely neurodivergent how to navigate the complexity without feeling frustrated, hopeless, and angry because the reality of how society is? What is the first step?
Yep, that's a great point. I think you have to be okay with the discontent and the frustration, and somehow figure out, what does life look like? What is your life? Forget about everybody else. I actually had to do this with my children when I had to navigate different educational paths and realized that one of my children was very sick and was not functioning, and we had to prioritize health over everything else. And there's so many emotions, and we are all, as 2E individuals and complex individuals, get very keyed up on all these issues. I think you have to find wherever peace is for you, and learn to live with some of those strong feelings and have a place to deal with them, and kind of just figure out put your blinders on and forget about everybody else. What is going to work for your family? And that's what we had to do. We had to my family, because of some of the gravity of some of the issues, like there was a point in time when I couldn't work at all. There was a point in time when one of my children couldn't go to school, and I had to figure out a way out and how we were going to survive. So I think just getting support, whatever that looks like. Does that look like therapy for you? Is it more of like somebody helping you in more of a coaching role? That could be helpful too, where you get to specific goals and to get things done, and figure out how to be successful. Yeah. But also a place to deal with all the feelings and emotions too.
Yeah. I think that's all we really have time for today. So thank you so much, everyone.
Thanks for coming, everybody.